Thank you everyone for being here. We've made a commitment to maintain and update the community on the ongoing efforts and the work and collaboration being done to deal with the coronavirus, specifically the strain, the COVID-19 strain. Our commitment remains that we'll be briefing the public with information on a daily basis. We'll be doing Facebook Live briefings moving forward each day with Dr. Gupta and myself and Commissioner Weirs. In the event of any material change in what would other be routine information, certainly we'll bring everyone back together again. But we felt it was important to get back together again today as it's been a little bit of time. The situation, we know a little bit more about where the virus is impacting in what areas of our state and our country, and certainly the information is still evolving and changing, but we just wanted to give a full briefing on where things stand today. Certainly nothing has changed in regard. There are no confirmed cases in Onondaga County. We have 19 individuals who are being quarantined. These quarantines are due to travel. And I'm going to have Dr. Gupta specifically get into what quarantine protocol looks like. And I think that's important. We'll be getting out information to the public on what that means. People hear this, but it's important that the public understands what that means. Certainly, we believe this has always been about planning and preparation. There's no reason to panic. There's nothing. There are no cases in Onondaga County. We have been preparing specifically for this virus for a period of time now. And we prepare for incidents and or emergencies year-round. That's what Commissioner Weirs does with his team. But you never know what you're going to plug into that preparation and how that's going to impact. But certainly with this situation, we've been preparing specifically for this, and we feel very well prepared at this time. It's in light of all this, if you're sick, contact your primary care provider and don't go to work. If your child is sick, get them to the doctor, and they should not go to school. In related to that, we've had many briefings with our government partners. We've had many briefings with our school districts, working on protocols with them. We've been talking to and will continue talking to and having meetings with nursing homes and living facilities and all other local governments. As we know, with the virus, it is having a bigger impact on our elderly and certainly folks who have autoimmune deficiencies, but it's important to note that children, although have not been impacted in a negative way at this point, but they still can carry the virus and interact with everyone. So we've been preparing and working with all different groups that really in every single community to get them ready for this. Certainly we want to address, and there has not been a case of this in Onondaga County yet, but we're very disappointed across the country with certain situations where we have seen price gouging for cleaning supplies and sanitizer. This is not acceptable, and we're looking at our powers that we have to address this issue if it happens in Onondaga County, but we are all neighbors, and we ask the private sector to be good neighbors in regards to this. Putting hand sanitizer and gouging prices, because there isn't a lot of it right now, is not acceptable behavior. Again, we talked about earlier related to quarantines. Right now the quarantines are related to returning travelers. This is a moving target. If you remember last week, I think when we were together, I think we had 12 people under quarantine. Then the day later or 2 days later, it went down to 9. We have more of our residents coming home, and then they're reporting in to us through our health department, and then we go through a quarantine protocol with them. I know it's been reporting about testing for the coronavirus. We're very pleased that our physicians have this ability now. This is good news. We want people who are symptomatic getting tested. that allows us to be able to do our job and prepare for whatever the results of that test look like. Again, we've not had a positive test at this point, but certainly that gives us the ability to implement our plans in the event we know someone is carrying the COVID-19 virus. So we think this is a good note. I know I did read the reports from Syracuse.com, from Jim, about the test being done at Krause. This is a good thing. If someone's symptomatic, we need to know if they're carrying the virus or not. And for continued information, certainly our health website is being updated daily. There is a button on the county's homepage with frequently asked questions that are very, very helpful. But we will be doing this Facebook Live moving forward, giving a briefing, and so we will continue to be there. We've also studied the governor's emergency order, the impacts, what the governor now has flexibility to do, how we can tie into that. We've studied certainly our executive power that we have in the event of a community spread, and what powers we have to implement social distancing policies, and if need be, we're prepared to act. So saying that, at this time I'd like Dr. Gupta to certainly talk more about what quarantine protocols look like, and then after that we'll take question and answers. Doctor?
Thank you. Good morning. Thank you for being here. Thank you, County Executive. So as you all know, the global novel coronavirus situation continues to evolve and expand in the New York State, including you have seen the Westchester and so many other county. So as of now, as of last night actually, there were more than 110,000 cases globally, more than 3,800 deaths, and almost 62,000 people who have recovered. I just want to emphasize that this is important, that we often forget in the emotion and then anxiety that 80% of people actually do better to actually recover. They have mild symptoms. In the United States, the cases have increased to 554 in multiple states with 21 deaths. In New York State, the reported cases as of what was reported in the New York State website, Department of Health website, 105 cases, out of which 12 are in New York City and 82 are reported in Westchester County. There are other neighboring county which has few cases also. As you already know, the clinical symptoms of cough, fever, shortness of breath, body ache can vary from severity from mild to severe. And just again a reminder that majority of people, 80%, have mild symptoms and they will recover. Our main concern are those who are elderly, those with underlying problems and have serious disease who may require hospitalization, and they may have increased probability of having complication. As you all know, County Executive also mentioned that March 7th, Governor Cuomo declared the state of emergency to contain the spread of virus, which provides certain opportunity to have additional workforce in terms of public health work. So we remain vigilant in our community and working with all the partners, especially our health system, to streamline the process to identify people who should be considered for testing and quarantine. Now, there are two different kind of quarantines. I think one is we call isolation or mandatory quarantine. It has been used, this word, in New York State. And there is called voluntary quarantine when we are asking for the returning travelers. We continue to do active surveillance, engage community partners in this intense public health preparedness effort, and remind everyone that they can and they should play a role in reducing the transmission of this virus. By using simple preventative strategy, you're talking hand washing, staying home, covering your mouth and nose if you are sick, right? And cleaning the environmental surfaces, stay home. Don't go to work, don't go to school, talk to your employer, talk to your teacher. All these things are simple measures, but they're very effective measures which will delay the emergence of community spread in our community in the future, and it will reduce its ultimate impact. So my biggest ask today of those county residents who are returning from countries, those especially 5 countries, China, South Korea, Italy, Iran, and Japan, that according to and follow the CDC and New York State Department of Health guideline, we are asking them to voluntarily quarantine for 14 days to protect not only for their health but also their family and health of the community at large. What does that quarantine means? We talk about these words, what the quarantine means. I think most of it, I would say that you can always go to CDC and New York State Department of Health site, our website, the information is there. However, simply that for 14 days, you're just going to be staying in your house or apartment. We ask you to take your temperature twice a day and practice social distancing from anybody. Stay home and avoid contacts with others. As we mentioned, do not go to work or school, any other activities. Do not take public transportation, taxis or ride-sharing services. That is important. Avoid crowded places like going to mall or movie theater or going to games or different community events you have planned. So you're not only protecting yourself because you are in that stage at this point that you came from that country. If you may have been exposed to unknowingly, and if you develop symptoms, you are the one who can get care, but in the meantime, you're protecting everybody else. That is very important, and that has been very effective. If you look at other international facts, when you are looking from Italy or Japan or any place else, those things, and even from prior incidences in the United States with the H1N1. And keep your distance from other about 6 feet or 2 meters, including pets. That is important. And quarantine means if you are sitting, if you have, we ask people to have their own bedroom, their own bathroom. If it's not possible, you have to literally wipe clean that bathroom and make sure before somebody else uses it. If you have a backyard, unless it's a shared somewhere, you want to stay confined to yourself. That is a little hard, I understand that, but that is important. How can people help? I think a lot of times we have FaceTime, we have people call, texting. Everybody can help support. Neighbors can support, the family can support, because it can be very lonely if you're by yourself in the house. So we are asking everyone to really help the person who is not only quarantined, taking with themselves, but also support their emotional health. That is important part. So if you get sick, that is the part if you're in quarantine. What do you do? If you get sick, you have temperature, cough, or have trouble breathing, we don't want anybody just run to the emergency room. That is not a good way to do. Or just walk into urgent care or walking to a doctor's office. We are asking them to call their doctor, get the advice on the phone, and then have them ask the right question and give you the professional advice. If they feel that your symptoms warrant testing, or they are more that you really need to go to the emergency room, they will coordinate with the emergency room and for the testing as well as for further care. We as a health department are there to help and support them. That is what our key role is, and continue to monitor the situation. And when you're calling the doctor, make sure you tell the exact history of your travel, that which country you were in, if you came for not that country actually directly, but you had stopped by there. It is very crucial for the medical providers to hear the right history, because there is something called identifying a problem is asking the right question and the person to tell the right answer. So we are asking people to really be upfront about this, not only to do self-quarantine, and also report to their doctors if they have symptoms. And certainly we are there to help any questions if that's the case. Most of the time this is doctor and patient relationship in that way. We are monitoring few people, but they are not all of them who are coming to that. A lot of focus which comes from the New York State Department of Health through the CDC, which comes to us, and then we are monitoring those individuals. For certain special things, if people are in dialysis and all, if they have traveled, I think they got to call their doctors ahead of time because there are multiple people there. So taking these simple steps can not only protect yourself, but also to your family and rest of the community. So I am asking everybody to make sure they stay engaged, they get the right information from right resources, which is science-based, not like somebody made it up. It is very important to have the fact-based information from CDC, from New York State Department of Health, from our Onondaga County Health Department, because we can work together to ensure the health and well-being of our community during this emerging COVID-2019 public health crisis. Thank you.
Just to reiterate one of Dr. Gupta's points, the importance of if you're symptomatic and you call your doctor is not to just rush to your doctor physically or rush to the emergency room. We have a vast medical infrastructure here in the community, but we want, if someone is symptomatic, we want to be able to isolate any potential risk to everyone else. So that, I think, is important for all of you to help tell that story. Certainly, questions?
Dr. Gupta, I just had a follow-up question for you. It's on about testing. What I'm wondering is, if a person's doctor orders a test or wants them tested, what happens next? Do they have to contact your department, the state? How is that?
Right. So as you probably have seen, New York State Department of Health has pretty much opened up a little bit more testing, so any provider can test it, and this came from the feds and then directly to the state also, that any local provider who after talking to the patient do feel that testing is need to be done. At this point, they are working with the hospital systems and having that testing done. We at the local health department do not have lab or any capacity to do the testing. Since we do not have any cases at this point, we just are in a more of a preparatory mode that what could be the other alternative site where we can have it tested. It's a work in progress, but at this point, anyone who is symptomatic and needs to be seen in this context, they will go through the triage system in terms of trying to go through, make sure that they are not actually everybody rushing to the hospital to get the testing. It has to be the person who really need the testing will be communicated by the doctor with us as well as with the hospital system.
The doctor will contact you, and then from there, the testing will take place in an emergency room?
So at this point, that's what we have put the process in place, because right now what we have seen, people's questions are coming mainly if they have traveled, and we look at the risk exposure, and then after that we can provide that guidance. So we are in constant communication with the outpatient primary care doctors, who they are working together with the health system also at this point. So some of the question you're asking at this work is evolving at this time.
Have you gotten many inquiries about tests, from doctors who want their patients tested?
Right, so most of the inquiries which we have been getting, they're coming from outpatient offices, but a lot of the majority of them coming from the emergency rooms because people are already being sent there, and what we are in a preparation mode is trying to have the primary care doctors feel comfortable making those calls that this person needs to be testing, should be tested or not tested, with working with all the infectious disease doctors of the hospital and health department, trying to provide a guidance to them so that they will feel comfortable making that judgment call at that point. The testing site at this point there's no alternate site, but that is something which we are looking into it. I think we have touched upon it the last time also.
Yeah. So
Not at this point.
Right now, we're working through your doctor and arranging for the appropriate avenue of testing. In the event of a community spread, that changes. And we talked a little bit about surge sites, and so that's something that in the event of a spread, we will have new ways to handle this, and the strategy then changes.
Ryan, what can you tell us about the pending case in Kronos?
I don't think there's much to really tell, Andrew. I think we got a case where a doctor, we have a patient who has some symptoms. The doctor's doing their diligence and saying, you're somewhat symptomatic, and let's get you tested.
And did the hospital have to work through the county health department in order to move forward with that process?
So that has changed at this point. It is based on the criteria. If you go to New York State Department of Health website, they have a criteria they changed that, that any health provider treats testing for COVID-19 shall be authorized by a healthcare provider when there are 5 criteria, and any physician, if they feel that these criteria are met, they can order the test. However, there is one criteria in which there is a kind of in between. They consult with the health department, but even though this is an open criteria. There is also a discussion with the experts within the health systems that, because if you do unnecessary tests, it doesn't kind of help anybody. So that is, this process is being actually, there is very thorough process which the hospital system use in terms of who should be tested and who should not be tested based on the history, based on what are the criteria, and marry them together. And then a lot of times is, since concern everybody has that could we have a case here, so they could be a little low threshold at times to do the test, but still not that you go walk in there and say, hey, I want to be tested for COVID-19. That's not the case.
Is there travel history connected to this case across pending case?
So first thing is, we do not discuss any person who is being tested. That is something I think we should make sure that people's privacy is protected, and it doesn't serve any other purpose. I think it's most of it is that the physician who ordered it must have to go through the very detailed history and make the judgment call. So I'll leave up to that.
People quarantined, you said travel. So you
Right.
can't say if a tested person traveled?
So that I don't have that information, so I'm not going to comment on that. But at the same time, there are criteria with the travel, but there is a fifth criteria which actually says that if people do not fall into that category and you feel, the provider feels, other cases where the facts and circumstances warrant as determined by treating clinician in consultation with the state and local health department. So there is a room for that. And that's something which we want that providers to have that flexibility in there, because they are seeing the patient. They are the one who are taking care of them right there. So they make the judgment call at that time, and they do. So we are not going to comment on case-by-case basis. I think we can defer to talk to the hospital, but that's not the health department's job to talk about individual cases.
Dr. Gupta, is it just one person who is being tested at Kraus? Is anyone being tested at Upstate or any other numbers on who's being tested?
So right. So you can ask that question to individual hospitals. We, at this point, do not have that information. State is working to, that's a lot of those things is that if the tests are being done, how are we going to know? We are going to know the positive results, that's for sure.
So you don't know just if somebody just goes and gets tested, they're not going to go through the health department?
No, they are not going through the health department at this point. Yes, so the process was different last week.
St. Joseph, they were told to test for everything in the health department.
Right, so it changed, right? So yes, it was true when we had the last press conference, and it was true till this new directive came out in which that was expanded. So it was in matter of last few days, actually. I think somewhere it happened on Friday. I can't remember which day it was changed, but that was the one which just opened up for the providers, because the triaging capacity also exceeds. If you look into other counties like Westchester and all, if you need to have tested, there are so many people who are there, there's no way the health department can continue to do. I don't know what was the decision, but in terms of having that provider the ability to test, at the same time give them tools that they can triage patients based on the history, I think it's a key here. Because these are the physicians who are the primary care provider. I practice medicine, so I know if I was in my office, I will get those calls. And then I should be able to talk to my patients. Let's say if you have lots of patients, your 15 patients are calling you, and then you should be able to give that advice to them. Okay, tell me these things. Do you really need to be tested or no? Based on, I can talk to you on the phone. And if that's the case, then I can give that at least the initial judgment call. And then talk to the other, either infectious disease, people have there in the hospitals or in the practices, or then they call us also. So we work in there. In that context, we continue to work with them. To provide them guidance. This person is the right person to be tested. This person, there are criteria which does not fulfill. Right? That makes sense?
Yeah, I guess I'm just saying, it seems like it would be easier if there was just one central place where all the information came out, as opposed to.
For example, statewide cases are coming from the governor's office. So
Right.
I think Onondaga County cases can come from the Onondaga County governor's
Right.
office.
So it will happen.
Yeah, and they will. We don't have any. So, right now we have a situation where we have doctors giving medical advice, and they're going to go get a test. At some point, we will know that a test was given with our partners. There's no point in talking about and breaking down information on negative tests. That's a nothing burger. It's somebody who's just got sick. But once we have a positive test, that changes things, and it changes the level of detail and conversation we get about quarantines and whatnot. That triggers different things. And so I think overall, everything's evolving. And there's new guidance being given to our health department from the CDC and then the state and whatnot. And so as those things evolve, we'll let you know what evolves. But overall, the bottom line is there's nobody who's been tested positive at this point. We appreciate and value the fact that if people might have a chance of having this, that they're getting tested, because then that allows us to implement our plans and strategies to contain that potential spread. And that's critical. And one of the things, too, we want to encourage families to do, and just be proactive. Think through these things while you're at the dinner table or whatnot. And in the event that there is a quarantine, what does that mean? Who do you have that can help you do these things? And if you don't have people, then we certainly have an emergency management department that we will certainly be helping the public get the basic necessities as well. So, but that's really where it is right now. I know people want to get excited because the tests were given. There's a little bit of anxiety about that. There's no reason to be anxious about that. It's not sustainable, as Dr. Gupta said, to go test every human being right away to see, who's got what. But if there's somebody who's symptomatic, they go through their process to their primary care physician who knows them best. Then they set up a procedure to go and actually get the test. Once we get the result of the test, that triggers different behavior.
So if I can add to that, is the reason for this is a negative test. We shouldn't be testing that how many people are being tested. The main thing to what the county executive just clarified is, I just want to re-emphasize that if there is a positive test, that actually starts a different process. If the person is in the hospital, that person was already isolated, but that person is stable enough to be discharged, we have to put them in isolation outside, in their own home. That means what we call, the governor has used that word, it's a mandatory quarantine. Then we actually will have to be very actively involved with the health system partners, with the emergency management, because we'll have to fulfill the needs of that individual. Checking on that person, if they need medication, if they need food, if they have other things, and also making sure their mental health needs are met, because a lot of time people get very scared of these things. But those people who will be discharged after being positive they are stable. It means, like, for example, people get treated for pneumonia, outpatient all the time. Not everybody gets to the hospital and hospitalized. They are discharged. They say, you have a little pneumonia, you got to be treated. People who have for example, the other example will be the chest pain. Patient go to the hospital, they get all the evaluation, they get the cardiac enzymes and cardiogram and all those things. Doesn't mean they have a positive test. So we, instead of focusing on that how many people are being tested, I think we should say that how many people who are in voluntary quarantine, which we are asking them, monitor the symptoms and contact your primary care provider. That is so important, and go through the right screening process with your doctor to make sure you get the right guidance so the right test can be done at the right time. Hopefully it will be negative, but if it's positive, we are ready to take on that. We as a local health department will have all that information anytime, because that's in terms of positive test, because that's where our role becomes very significant in terms of making sure that mandatory quarantine, or what we call isolation, at the community level is going to be implemented. In the hospital, it's safe because everything is very controlled there. When they go out in the community, that's the time we'll have to make sure that these people are really confined to their own home. It's a little different than the voluntary, in which we are asking willingly to do that. There's no enforcement there. In the mandatory one, we'll have to enforce that. That's a big difference.
And that would come with a positive case only.
That will come with the positive case, and that's very important for people. So the people who are returning travelers have such a significant role to protect themselves, their own health, as well as the community at large. So that's my biggest ask of them, to make sure you please follow those protocols.
And can you spread that message to people if they're coming back from either one of those 5 countries on the CDC list, or even, I don't know, if there's another country that you'd be concerned with a lesser level? What do you say to people in another county coming back from those places? Should they call you as part of their process to return home?
Right, so at this point, I think if we are asking them to do 14 days quarantine, they're most welcome to call us and provide that information. At this point, we don't know how many people are coming back in our community, right? So yes, we are always ready to take people's phone call and provide the guidance to them. But some of those things they can do on their own. We are asking their active participation in not only their care, but protecting the community. Taking the temperature twice a day, staying home, don't go to work for 14 days, don't go out in the social events, no movie, just watch Netflix or whatever you want to watch, and just chill at home. That's what we are asking. And if their family and friends can support, but some people don't have any families, and so that's where we come into the picture.
So one thing I'd like to add to that real quick too. If you do come back from one of those countries and you do become symptomatic and you feel that you need to be transported to a hospital by an EMS agency, it's absolutely critical that you give our 911 call takers that information. So that way the first responders can prepare themselves to limit any type of spread, and also make sure that the hospitals are ready to receive that patient. So the more information you give the call takers, the better prepared our responders are going to be, and the better prepared the hospital is going to be to limit any additional spread if in fact that person does become a positive
Are
case.
they trained also ask preventatively?
Yes, they are. They've changed the procedures to make sure they're asking international travel questions.
The 19 people who are voluntarily staying at home, did they travel to one country, or do they include travelers who went to all 5 or some of all 5? Can you tell us which countries?
So predominantly they're from China at this point.
Mostly?
We have started to get some other ones too, but predominantly they're still from China.
And they've notified you that they were self-quarantined.
So no, this is the state actually sends notification to us through the CDC part. And then some people have called themselves from different countries actually. So the people have called us as well, yeah.
Ryan, the price gouging thing, what can the county do, and have you noticed anything?
Yeah, we haven't seen anything yet. I know some of my colleagues that I've spoken to across the state have these issues on Long Island specifically. So we're looking and reviewing what authorities we have, what powers we can execute if necessary. It's just common sense, though. I mean, let's not take advantage of a community fear at this moment to make a couple bucks. I mean, it's just ridiculous. So, so if we get any cases, we'll be ready to act if we know that certain businesses are acting in this really unethical way. We'll certainly act with all the tools we have available.
Doctor, is the test for coronavirus still the oral swab that really any physician is capable of?
Yeah, I mean oral and nasal swab.
And then they send it to Wadsworth, that's where the testing limitations are, the actual backside of it, correct?
Right, so no, they have expanded there's a more testing capability. That is, I don't know when they are going to go alive, like Quest and some other institution locally. So I think that is coming soon. That is important because that will increase the capacity to do the testing in addition to Wadsworth.
But I think people get confused because any physician can actually sample for a sick person. It's the backside, it's who they send that sample to actually process the sample.
Right. So there's one more thing to that, because you have to have protective gear at this point. So that's why that's a concern that these people who, if especially they are symptomatic, if they go walk in the waiting area, you have other people there. That's not what they are looking for. So a lot of those things is not doing the test itself is very simple. But where to do the test, that's the biggest one at this point.
Dr. Lucia, going off of that, Governor Cuomo yesterday in his update, he called for the expansion of testing, and upstate being one of those places. Is there
Right.
any word on upstate's testing and the lab that they have there, and how the county will be involved with that, Ryan?
Well, look at we very much want Upstate to be able to do these tests. I don't think we've heard exactly if they're a site yet. We anticipate they will be one, but from the standpoint Upstate's word is Upstate because it's the regional hospital, not just for Onondaga County, but for all our other counties that have yet to be impacted. So it would make perfect sense, and I think you heard the governor talking about Northwell on Long Island, and it would make perfect sense to have regional facilities that can do this testing to really turn around the timeline faster. But I don't think we've heard, Doctor, unless you got breaking news that Upstate's
No, so
ready
I think
yet.
you should talk to Upstate because they are probably work in
Yeah.
progress. That will be the best way they can answer your question, and we'll be very excited to hear whenever they go live.
Yeah.
How does transportation work for these test samples when they're heading out to Albany?
Still
Is it-
driven?
Oh, for the Albany, they
Yeah.
usually can do FedEx. They can do if people feel very compelled. Sometimes
Driving.
we have done driven there
Yeah.
also. So that depending on the situation, yeah.
Depending on the county, maybe is making that call, or?
Yeah, I think in both cases they've been mailed and driven, depending on what they are and the severity of the concern.
What time is the FaceTime thing gonna be? Is it gonna be the same time every day?
Yeah, I think we'll probably do a midday briefing each day.
Just gonna just
Yeah, I think we're going to give you information that so the public continues to hear updated, accurate information, and again, if there's any material change in the circumstances or the plan or policies, then we'll all get together again. I think it's important. One of the things too that we've been working with, especially our other governmental partners, and I think the private sector really needs to focus in on continuity of your operations, but how are you dealing with employees and sick time and making sure that we don't have employees coming in that might be symptomatic. And so we've come out with our own guidance for our own department heads and workforce so that we don't have individuals who might be sick but might only have certain days left coming in. So we've come out with our own policies for our workforce that encourage people, if you're sick due to these symptoms, due to this strain of the virus, stay home. And it's not going to be a punitive situation, and your child as well. Certainly, we need to be vigilant on all ends of that.
So 11:30, the briefings will be in.
Yeah, we'll get you out something later today. It might be noon, but 11:30 or noon we'll be doing briefings on FaceTime Live.
Are you giving organizations any advice on whether they should continue to hold music concerts,
Yeah.
sports events,
So-
other large gatherings?
Yeah, at this point we don't have, and I think it's important because there's certain things that people are asking questions, and depending on where you are, it matters more, right? If you're in Westchester County, you're probably not shaking hands anymore, right? I think Dr. Thomas talked about this on the news the other night, but in Onondaga County, we don't have a positive case, so is it probably shaking hands? Some people are not. Fist pumps, some people are not. Elbows, I think Dr. Gupta's favorite way is she likes the elbow bump. So that's certainly, but look at, yeah. But in that note, social distancing is something that we will look at in the event of a community spread and what that means. And certainly there's just common sense stuff, Jim. I mean, if you're not feeling good, you got flu-like symptoms, like, don't go take an Uber. Like, maybe you shouldn't go on an airplane. Certainly, I think there's been more guidance on cruise ships, but that's common sense. Whether or not, we have the benefit of learning from these other communities on the decisions they're making in real time and what the impacts are. So we're not going to implement any preemptive social distancing policies that will drastically impact people's quality of life, way of life, or the economy at large until the data merits that.
Syracuse University, Cornell University, they're all putting out some pretty advanced recommendations of not even traveling domestically. We're starting spring break season. There'll be a break in April for kids. Is there any conversation with school districts about something that substantial, a suggestion that you shouldn't even get on a plane domestically?
Yeah, Andrew, I think again, the data is going to drive this type of guidance. And if you're looking at certain communities that have a widespread, spread, a community spread in certain areas that may be a spring break destination. I think certainly individuals can use common sense, and I think it's good. Many of our universities, we're a community that's rich in higher ed institutions. That makes the planning and preparation more important and more complicated for us in this region because all of the international and abroad programming and where all these people just come from within the United States. So I think everybody's giving out good guidance, giving out good counsel, but let's get there before we worry about April 4th to 11th or whatever the days of vacation are, and look at where people are talking about going. Certainly if you had a spring break cruise that you're looking to get on, probably not a good idea, right?
But if I'm going to Italy next week, I probably can plan on staying home for 2 weeks after I get back.
If you get back, right?
Well,
Yeah, so, yeah. So-
Italy is in a level 3 alert, so we
Yeah.
should be going there.
Yeah, and that's internationally, I've heard many doctors say this, I think maybe Dr. Gupta maybe as well, but if you're going to travel internationally, think about how you get home. And think about what that's like and how disruptive that could be to your life and your family's life. So those, I think, are really fair points at this point in this. But overall, from the local standpoint, there's nothing here yet. Inevitably, we'll probably get a case, and then we need to look at that case, where the nexus of that came from, and the reach that this individual may have had with other people, and then looking at really what is then a different type of quarantine, right, for people who've been in contact, and then you make those decisions based off of that data on whether or not you continue to utilize the On Center and the War Memorial and all these other resources locally.
New York State has the most cases of anywhere in the country now, because that makes sense, right? New York has the largest
A lot of people,
metropolis by
yeah.
data, that makes sense. Should people be concerned though about going downstate and then coming back home?
So one of those things you have to remember in surveillance mode when we do case identification, the more you test, the more you will find. They have taken a very aggressive approach in testing in Westchester County, so you are going to find more cases. There is no doubt about that. Is it because we have more cases? It's hard to tell. Are the other states testing that aggressively as the New York State is? I don't know the detail, but I will tell you because we work with the State Department of Health, and the effort, the guidance that comes from them is to test, not presumption at this point, because there is something called epiphase, like you're trying to see that is it here for us. And I think that's what New York State Department of Health is trying to identify the cases, and hopefully, we will have a better understanding that how aggressive or how many cases we have that. And so it's testing versus true cases in the other one.
I just have one question. I know you both and the governor as well are working really hard to drive home the message, facts over fear. But I do have a question about accountability. So, for example, the people who do travel back from these countries with widespread coronavirus and are asked to quarantine themselves for 14 days, any response to people may not follow that? What's the response there in terms of accountability? What would you like to say to people who
Yeah.
do travel back?
Look at, I think it's unclear if they're breaking a law at this point, but I would say they're putting themselves at harm risk first, and that this is not disruptive for the most part. If you're traveling on business, I'm sure you traveled with a laptop or some form of computer, and you're used to using that. And your employer, I know employers here, throughout New York State that are very, very much interested in having their employees stay home if they were over in another country, and they can still get their job done. I mean, that's the amazing thing with technology these days. And their families, you're putting your families at risk too by not working with your doctor and working with the health department and our team when you come back. So whether or not it's a crime, I will let the lawyers give us guidance on that question. Certainly, it's not smart. And to be a good citizen, you're coming back. I'm sure when you went to one of these countries, you didn't think about Corona or the COVID-19 virus strain. Nobody's mad at you, but you may have been subject to something that could harm you, your family, and your neighbors. So let's just be smart and let's work together, and we'll all be stronger as a community on the other side of this.
So the only thing I can add to that is most 98% of people actually do follow voluntary quarantine recommendation, because most people actually want to do what is right for not only for them, their family, and the community. So that is very important fact to remember, that the people who we have spoken to, some of them, they just call, they say, we put ourselves in the quarantine. This is something, it's so nice to hear that there are people who really want to do the right thing. They look for guidance. Mandatory is the one, and they're asymptomatic. You have to remember that. So we cannot enforce that part in asymptomatic. When they are symptomatic and they have a positive case, if they are trying to do, that's where that becomes an enforceable thing.
Yep.
Do our hospitals and nursing homes in the county have enough supplies to deal with a potential big outbreak?
Dan can touch on that. One of the things we've been doing, Jim, is we've been working with all of our partners on what the supplies are, where there are shortages, and planning for a community spread, so that we've been coordinating those efforts with all of our partners, and have, I believe, a couple large orders in. Dan, do you have anything else to add on that?
No, it's we're also working with the state on that. So we've heard a few requests from some of our local agencies as far as resource needs, and we're working with them to try to identify sources for it, whether we procure it or we go through the state. We're trying to get everybody the essential needs that they have.
Again, and that's that's your EMS departments, that's your schools, that's your nursing home, long-term care facilities, hospitals, governments. Other questions? We good? All right, folks, appreciate it. Thank you.
Thank you.